Okay, I have the top of the hour, so we're going to go ahead and get started. My name is Meg Floyd. I'm the Vice President of Product Marketing here at Remarkable Health. And if you're looking for a guided tour of our Insights app, then you are in the right place. Again, thank you so much for being here. Today we have one of our experts here to discuss some of our Insights unique features, including visualization of your data, key performance indicators, and various ways to gain insights into your agency and staff's performance. But before I introduce today's speaker and agenda, I just want to go over a few housekeeping items as people are joining us so we can make the most of our time together today. First, all of your lines are muted. This will eliminate any background noise during the presentation so we can hear our speaker loud and clear. But even though your lines are muted, we still want to collect and hope you have a bunch of questions for us throughout the presentation. So we have reserved some time at the end to make sure to answer those questions out loud. So you should see a questions panel there on your screen in that Zoom webinar platform. Feel free to submit questions to us at any time during the presentation, and we'll make sure to address them at the end. If we don't get to all of your questions, I think we will. We have plenty of time today, but if we don't, we'll definitely make sure to create an FAQ and send answers to all of your questions after today's presentation. Finally, we are recording today's webinar, so along with the FAQ, we will send you a link to the on-demand version, along with a copy of the slides in a PDF format, so you can share all of the great things you hear with your colleagues, or if you want, you can feel free to watch it again. So if we want to move to the next slide, I'm happy to introduce our speaker today. As I mentioned, my name is Meg Floyd, and I will be your moderator. But we also have Alan Ortego with us, who is our CTO at Remarkable Health. Alan, you want to take a few minutes, or actually a few seconds, and just introduce yourself?
Sure, thanks, Meg. So as Meg said, I am Alan Ortego. I'm the Chief Technology Officer. I have been with Remarkable since about the May timeframe. And if I have not met you previously, welcome, and I'm happy that you're attending today.
Awesome. So just a quick agenda. We're going to spend a few minutes going over an introduction, but we have some poll questions for you guys. We just want to get to know each other a little bit more and just make sure we're, presenting the right things when Alan shifts to the demonstration of the Insights tool. So there's just a few poll questions. How that will work is I will launch the poll, and then you will see a pop-up appear on your screen. Just go ahead and click the answer that is most relevant to you, and then I'll share those answers with the group just so we can all get a sense of some obstacles and challenges and other things that we're facing when it comes to our data. And again, just make sure we're on the right track as far as what we demonstrate in the Insights app. So just wanted to give you a heads up there. And then Alan will take it from there, and he will do a demonstration of Insights and dive deeper into the tool. And then, like I said, we have reserved some time for Q&A, so make sure to keep those questions coming. Okay, so obviously we're here to talk about our Insights app, but first I just wanted to share why developing a business intelligence application was such a high priority for us last year. And as some of you know, there's quite a few of you that actually attended our mobile webinar last week. Our mission at Remarkable Health is to positively impact lives through wow moments. And we do this by developing outcome-focused technology that helps remove the obstacles that you and your staff encounter when delivering quality care and outcomes. And we know that you all face many obstacles, especially when it comes to your data. We've heard from customers that accessing, collecting, and analyzing your data is a huge challenge at times. It's a very manual process and time-consuming, and usually takes quite a few resources to do it on a consistent basis. And we also heard that once you get it all together, it's not really in a format that's easy to understand what the data or the story behind the data and what to do from there. So that's really what we were trying to solve for when we developed the Insights tool. And with the shift to value-based payment models and the demand for your staff to do more with less, getting access to this data and most importantly, knowing what to do with it once you have it is critical to the success of your agency. So hopefully some of you are nodding your heads in agreement that it can be challenging at times to gain access to all this data when you need it. And you know, this is our goal, is to help you overcome this obstacle as your technology partner. We've invested and will continue to invest in developing new tools such as insights and capabilities to help your staff reduce the number of obstacles they encounter when providing care to their clients and reporting on those outcomes. So this is going to bring me to our first poll. So give me just a few seconds here so I can launch this. We're curious, what are some of the obstacles when it comes to your data that your agency is trying to overcome this year? So go ahead, hopefully you see a pop-up on your screen there. Just go ahead and select, what are some of the data challenges? Is it increasing internal knowledge? Is it streamlining the data collection and analysis? Is it compiling it in order to prove processes, or maybe some other ways? And if you did select other, go ahead and enter into that question queue what some of those obstacles are. So you guys are doing awesome. I'll just give you a few more seconds. Okay, I will share. All right, great. So I'm going to share the results. So yeah, I'm glad we were on the right track there with what I just said in the previous slide as far as compiling that data, but also, you know, streamlining it and just really increasing internal knowledge. These are all of the some of the reasons why we developed this tool. We heard this a lot from our customers and other providers that we spoke to over the course of our time here at Remarkable. And so hopefully you'll see some features and capabilities here that'll really help you overcome this obstacle today. So thank you so much for participating. There's two more. So if you didn't do this first one, you'll have an opportunity to join the fun in the next few. So if you want to move on to the next slide, and you know, really one of the main challenges too is that data is hard to gather when it's fragmented across many tools and applications, right? And we actually conducted our own research and had over 300 providers across the country participate in this research. And we asked them how many tools they are using to manage their practice, care, billing, and outcomes. And we're amazed at how many tools you all have to use to do your jobs every day. Multiple tools that aren't always integrated means obstacles to collect and analyze that data. So this makes it difficult for you to make more data-driven decisions and be in a position to be more proactive instead of reactive. You know, especially around your claims data, which actually is going to bring us to our second poll. We have developed a new tool, a claims analyzer tool, that's really going to provide you quick insights into your billing. Alan, do you want to take just a few seconds to talk about this tool?
Yeah, absolutely. So we developed a very light claims analyzer. So it is extremely light to use, and we'll give you a preview of the bigger ideas and the bigger features that are available in Insight. So it's simple to use. If you're interested, just fill this out as yes, and we can get in contact with you. But the way it works is you just take however many days of claims you want to analyze, whether it be 30, 60, 90 days, and we can get it both 835 and 837 files. All you do is upload them, and then after the upload is finished, you'll see a very nice snapshot of where your money was spent, who your top performers were, what services matter, where your adjustments and denials came from if they came across in the 835s. So there's a lot of cool stuff, and it's a free tool. We'd love to show it to you if you're interested.
Awesome. So I'm going to end the poll. Actually, I'll just give folks a few more seconds here. Awesome. Okay, great. So great. So for those of you that said yes or maybe, we will for sure reach out to you, provide you with the right, the necessary information, and help you take advantage of that free tool. It's really a great one. Okay, great. So we will move to our next slide. So integration is key, and that is why our fully integrated platform helps you capture data across the entire life cycle of your clients. And what we're calling our platform is an outcomes management platform that really goes beyond core EHR functions of clinical documentation, treatment planning, scheduling, service billing, and reporting. All of that's all included, but it also includes offline mobile, client engagement, and business intelligence tools such as Insights and that claims analyzer tool that Ellen just spoke about to help empower you all to demonstrate quality care and outcomes to both clients and payers. So for today, we are going to focus on Insights, which falls under the data module of our outcomes management platform. But before I hand it over, I have one more poll question. Let me just 1 second here. The last one is, we are curious, sorry, had a little trouble there. We're curious, how are you currently capturing data for your key performance indicators? Are you using a business intelligence analytics application? Are you just using reports? Are you just extracting and compiling them in Excel? You're not doing any kind of data capture or other ways that you're doing that we may need to know about? Okay. Just a few more seconds. Okay. All right, so a majority of you are doing some type of reporting or extracting those in Excel, which those are fun. I'm not an Excel expert, so we don't want to do that. But so it's good. Okay, great. Well, this is excellent. Thank you so much for participating in our polling and introductions here. So with that, I am actually going to kick it over to Alan. Alan, you want to take it from here?
Yeah, absolutely. Thanks, Meg. So I am here to show you our Insights product and give you a preview. I'm not going to do a super detailed demonstration, but I do want to give you a full overview of what it is, why we built it, and a overview of its capabilities. I'm going to dive through a few stories and give you some details of how and why we built something to provide you value. So first, an overview of Insights. So it is a business intelligence or analytical tool that we built, and we built several different KPIs. We have 10 in the system today, 2 to 3 more coming in the next month, and we're continually improving this and building new capabilities. And with the KPIs, they're all dashboard based. But then with the dashboards, they give you access to download the data. You can filter and sort, and I'll get through and show you that in just a second. And one of the nice things about it is very mobile friendly, so you can actually use your phone if you want to see how you're progressing, if you want to just get a little snapshot, and you just want to check in on a daily basis or weekly basis, however often you need to look at the data and do some analysis. You can do it on the go as well. So I am going to now jump over to the actual product. And you should be able to see my screen now. So this is our demo environment of Insights. Up at the top, you'll see who. So I'm the demo user, so you'll have your login. Over on the left-hand side is our navigation, and it's organized currently into 3 buckets: clinical, financial, and operations, just to give you some quick guidance into where these KPIs live. And each one of the KPIs are split into a summary view and a detailed view. I'll be mostly living in the detailed view today. The detailed view gives you additional capabilities like drill downs and drill throughs. So drill downs allows you to go from a high level and drilling down into a lower level, and then showing the same dashboard, but focused on the thing you just drilled down to. A drill through allows you to take the data set that you want to drill through and go to another report that allows you to see the data and filter and do some manipulation of that data live, and then you can download it and do some different things with it. So I'm starting off one with client services. So we have several KPIs over on the left-hand side. I'm not going to go through, I'm going to go through about 5 today, but just to give you a high-level overview of what is in each one of the KPIs. So progress notes, it demonstrates the total charge and time of the progress notes by both practitioner and by program. The diagnosis is to see your client diagnosis by frequency of type by year or month across all your different programs and locations. Treatment plans display the number of treatment plans per staff member and when they're due. I'll be going through this one in a little bit. Unused authorizations, so showing the authorizations that are available and those that have been used or are about to expire, and they're grouped by different time categories of when they're about to expire. Unsigned notes show the notes that they need signatures or they have not been billed once they are signed. So that's a very good one for tracking the performance of your staff and who is failing in certain areas. So a little Big Brother-ish, but it'll help you get an insight into how your staff is performing. Financial, you get down to the AR aging. So you get a very quick overview of which are your top carriers, how much you're billing them, and a breakdown of over time of how much you're billing to each carrier over time at a monthly level, and you can filter it by different time categories. Then claim status, I'll be going through in a deeper picture, but it's the overall picture of your claims, whether it's unbilled, billed, not posted, if they've been paid or not. So very good for your financial analysis, and especially for your building leaders to see at a glance how the agency is doing and how their staff is doing in the billing department. On the ops side, revenue. So revenue is obviously important. So tracking where your revenue is over time, which one of your programs is making the most revenue, which practitioners are making the most revenue. And so you can focus on, do you need to focus more time in a certain program or over another? And where do you need to grow? And then after that, you have appointments. So just an overview of all your appointments. So, and then client services, which is where I'm starting, is showing the number of clients with and without services and how they're grouped. So this one is a very good overview of showing what services you're actually performing in your agency and by what location. So I'm going to go through a little analysis exercise on this one in particular. So I've seen over here on the bottom right, these are all my top 10 services, and the ones that I should know that these are the ones that our agency is actually focused on. But the one that really stands out to me is we have a lot of non-billable client contacts. So let's figure out what is going on here. So first we'll filter by that. So filtering is just literally clicking on it, and I'll see most of it is in 90+ days, but that's hard to impact. So things that happen a quarter plus out, can't really do a lot about it. So let's filter on the 31 to 90 days. That's a lot more recent. It's in the last quarter. And now I can see, wow, most of it happened in both outpatient and medical services, and mostly over in this organization. So this location is doing the majority of the non-billable client contact. So we can do a couple different things. One, we can drill down deeper in each one of these, or we can just go and get the data and see what the counts are. But in addition to that, we can we can drill through to the program, and we can see all the different data, who provided it, what organization, what service type they were providing, the category, and then we can filter and do a whole bunch of other stuff in here. And then once we're happy with the data, then we can export it. And it just exports out into a CSV that's available for download. So I showed you a couple quick things on this one. So one, I filtered by just clicking, was able to drill down to show additional details, and then showed you the drill through to actually get additional details. So next, I'm going to show our treatment plans KPI. So all these are available, and they're quick load. I just did this for the demo. I have tabs up here. So with the treatment plans, the story and the analysis I want to figure out is, I want to know about all the treatment plans that are overdue and really target who is the leading cause of overdue treatment plans. So filtered by just the ones that are overdue. I'm not really focused on the ones that are coming up or that don't have a treatment plan yet. So these are my top 10, and so I really want to sort by the ones that really stand out. I want to see them compared to all their peers. And so you can see these top 3 right here have over 300 treatment plans that are unsigned right now. So me as a leader of the organization, I'm going to go to their boss and figure out what is going on. Why haven't these people completed their treatment plans? What is going on? Why are they all overdue? And then so I can fix that, and then obviously get things turned around. And then this is a very good snapshot of just performance. And then if you need to export this or drill further down, you can obviously do that. So going back on top of performance, the next KPI is unsigned notes. So this KPI is not only just unsigned notes, but the status of your notes. So you'll have signed ones that haven't been billed, but then you'll also have the billed. So you hope your graph is almost flat over here, and then everything billed. So what I'm going to be doing is filtering first on unsigned. So I really want to focus on who is not signing their notes. Again, this org1 is the outlier. And so let's drill through and see what's going on. And so now I can see by program, the medical services program is really the one that needs some help, followed by OCS. So with these two, if I knock these two down and get them to complete their notes, I can get billed for all these services. So this is just money sitting here ready to be billed that's just being blocked by people not signing their notes. And so if you need to go and drill down, get the data, you can drill down further, export the data, and then start going to talk to people. Very powerful, very quick insight into seeing, very quicker than just running a report. You can go and grab this data almost immediately. Next, I'm going to be going through claim status. So I'm trying to hit a little bit on each of the different aspects of clinical, financial, and ops. And with claim status, this one I'm going to investigate denials. So on the financial side, obviously you want to have clean claims going out the door. You don't want denials. You don't want to get clawbacks. You don't want adjustments hitting. It just slows down the process and slows you down from getting your money in the door. So looking at the denials, obviously most of our denials are coming from this BCBS of Havana. So what we're going to do here, so we're going to drill down through to see what's going on, see if we can target which services, which programs are having issues. So in this case, it looks like it's almost all, not almost all, but the majority is all in-home. So we have some issues with our in-home program. So we're going to take a deeper look at that. We're going to see go through and look at why, go through and look at what was denied. Is it mostly adjustments coming through? Did we do a lot of write-offs? So we have all this available, so we can then take this, hand it off to the billing department to do a lot more detailed analysis. We can see, do some analysis to see, is it specific procedure codes or is it just a specific procedure? And by doing that, so if we just wanted to filter on just Medicaid, that's going to filter this grid and sum everything up for just that. So this is super powerful, a lot quicker than Excel and doing all this analysis yourself. You can do it all in here and then export it and hand it off to people to go and do some work. And then the last one I'm going to review is your revenue. So what I want to do here is I was tasked with going and doing an analysis of all of my revenue for 2018, figuring out where it came from. So this is very quick to do. So this unselected 2017, and now it's just all of 2018. Now I can see a nice little breakdown of where the revenue is coming from each of my organizations. I can see which one of my practitioners is generating the most revenue. Ed Edwards and Ed Gray, so the Eds are dominating when it comes to making money for the agency. And as far as which one of the procedures, you can quickly see crisis intervention and Medicaid are probably the top two. But let's go look at what Ed Edwards is actually doing. Why is he so much better than everybody else? So let's see where he is focused. So he's really focused in crisis intervention, and you can tell he is making all the money in crisis intervention and mostly in obviously your crisis org. So that's amazing to see. And so it could be, with this analysis, now it is important that we go and focus more on crisis intervention. Maybe we put more clinicians and teach them, or get Ed Edwards and Ed Gray to teach what they're doing to get that much more revenue and create a program around that. So high level, those are the ones I wanted to show today. And if there's some KPIs that I didn't show that you would like to see, feel free to put those in the Q&A section. If there's some different information about these KPIs, definitely throw that in the Q&A section. And now I think we want to turn it over and see if there's any questions that we need to answer, and we'll try to do those live.
Yeah, great, Alan. There's a few questions that did come through. Can you hear me okay?
I can, yep.
Okay, cool. Sorry, just wanted to make sure. Do you define a time frame or a date range for looking at treatment plans? So is there any filtering that way?
So I forgot to mention that at the very beginning. So currently the data is pulled on a weekly basis. So it's a rolling 13 months, and it is pulled every single week. We are working to get that pulled down to a nightly basis, so you get more up-to-date data. So right now it is a week delay, or it could be up to a week delay in your time frame. But as far as it's purely based on the due date of the treatment plan, and that's what these filters are based on. But it's based on, you can see over here in the as of, that is what this is based on. Hopefully that answered your question. I see another one that just came through. What will be the cost associated with this feature? That is something that is outside of my department, but I would be happy to get you in contact with your account manager or sales rep, and then they can talk to you about that for sure.
So Alan, what other KPIs are you guys going to be adding in the near future that came in through the chat?
Okay, yeah, that's a good one. So the next one is Cal Locus and Locus KPI, and then behind that is I believe it is Daily Lives Affected, and I'm trying to think of the other one. I'm drawing a blank, but we can get back to you. In the response, we can send out the next 3 to 5 different KPIs that we're working on. And if you would like to see different ones, definitely let us know.
Great. So what data will these queries be ran against?
So the way this product works is there's an extract job that runs weekly right now, hopefully daily or even faster in the future against the CT1 database. That data is pulled out to a separate database that is on separate servers, but in the same data center as your CT1 database, and that is what these are run against. So it is a brand new warehouse-specific database for each customer.
Okay. Great. I'm just going to check the chat because some questions have been coming in through there, and I don't see anything. Okay, so we'll just, are there any more questions or even KPIs that you would like Alan to dig? We do have a few more minutes as far as our time together today, so I definitely want to take advantage of that since we have Alan here on the call. Are there any other KPIs that you would like for us to dig a little bit deeper or show you between our clinical, financial, and operations within Insights? Anything else you would like to see or any other questions?
I think we had one more question come from the chat.
Awesome.
And the question was whether it's available now and what is the target date for release. So it is currently in beta right now with 3 customers and likely to move out of beta very soon. So if you're interested, definitely let us know and you'll be on the first wave of who we reach out to get access.
So this is a great question. Can you pull data from other systems?
Currently, not today, but that is absolutely on our roadmap to be able to pull and ingest data from different data sources. So we've had talking and asking questions for people. So payroll is probably the one that comes up the most, being able to see the payroll data and overlaying that against treatment plans is probably the number 1 request. If you have other data sources that you think would make sense to work with and be able to either push or pull data in, we'd love to hear those as well.
Awesome. So yes, Aaron said outcomes would be a good KPI and totally agree with that.
I agree with that as well.
Okay, either in the chat or in the question panel there. Go ahead and keep them coming. I'll give you just a few more minutes. And again, if you want to see any other KPIs here, definitely let us know. Okay, I'm not seeing any more. Alan, are you?
I am not.
Oh, yeah. No. Oh, wait, we got one more. Right. Could we count the number of treatment plan objectives achieved per client per provider?
So
we count
we actually,
number, yeah.
I want to say right now, no, but that is something we can look at enhancing in this KPI. And we're also investigating treating a treatment plan as a budget and creating a dashboard around that. So that is something we're actively investigating right now of how best to do that. and it might be changes to CT1 to make that actually able to happen.
Gotcha. Yeah, Aaron, thank you so much, Aaron, for giving us some more KPIs to consider as far as something around scheduling, like maybe time to first appointment or available time to upcoming appointments. So those are all fantastic. Thank you so much. Just want to make sure.
Another one we've considered specifically on the scheduling is resource utilization. So how utilized is your staff?
Okay, great. All right, we'll give you guys just a few more seconds. Thank you so much for entering the questions and giving us some more great ideas to include in a future release. This is excellent. As you can tell, we love collaborating with our customers and our partners. So thank you. Okay. Well, with that, I just think we're good. I don't see anything else coming in. So we will end today with our presentation. Alan, thank you so much for showing us and taking a deep dive into insights. I know this has been very valuable given the many obstacles that several of the folks on the line expressed when it came to capturing and analyzing their data. So we really appreciate your time with us today. And with that, for everyone on the line, just be on the lookout. You will receive that email with a link to today's recording and slides, as well as the FAQ. There were a lot of great questions that we'll make sure to send back to you all with the answers. So thank you so much, and we will talk to you guys in the next webinar. Thanks.